Hello friends, once again welcome to the Hospital and Clinical Pharmacy. Myself Miss Malvi Rajendra Bhavsar, M.Pharma in Pharmaceutics. So now we'll start with the part 2 of Pathophysiology and Symptoms of Disease. In part 1 we discussed about several diseases like tuberculosis, hepatitis, rheumatoid arthritis and started with the cardiovascular diseases. That first disease was atherosclerosis. In part 2, we'll continue with the same. It is cardiovascular disease. Before that, the learning outcomes will be, student will be able to learn the pathophysiology of different cardiovascular disease, etiology, sign and symptoms of that disease. So, second cardiovascular disease is angina pectoris. It is the most frequent symptom of ischemic heart disease and a result of temporary relative imbalance of demand and supply of oxygen to heart. This imbalance is due to the inability to increase the coronary blood flow in response to the increased myocardial demand. This may be due to atherosclerosis of large coronary artery. Pathophysiology of angina. Normally the coronary blood flow can increase 5-fold to meet an increased demand. But in angina, this capacity is limited. Angina may also result from reduced oxygen content of coronary blood as in anemia, anoxia or smoking. It may also occur due to increased demand as in fever. Thyrotoxicosis or Paget disease of the bone may be also responsible for angina. Then signs and symptoms of angina. In angina pectoris, there is substernal discomfort, and discomfort may radiate to neck, lower jaw, shoulder and arm. Sometimes the discomfort may occur only in the arms or wrist. The duration of an angina attack can be from 30 seconds up to 30 minutes. Anginal attack begins gradually and reaches the peak intensity over minutes, then gradually decreases. So risk factors. First risk factor is genetic, that is example hyperlipidemia, diet or hypertension, habit of smoking, diabetes mellitus, gout, oral contraceptives, which leads to coronary artery atheroma, which is responsible for myocardial ischemia, which leads to increase in oxygen demand, due to which precipitating factors increase in ventricular pressure and size, increase in heart rate, there is myocardial contractility. Then acute reversible myocardial ischemia, which is responsible for coronary artery spasm, and again myocardial ischemia, which is acute irreversible. The next disease is congestive heart failure. Heart failure occurs when the heart can no longer pump adequate amount of oxygenated blood to the tissue to supply their demand. When the heart pumps blood at an insufficient rate, salt and water are retained by kidneys and fluid accumulates in interstitial space. Hence, it is termed as congestive heart failure. Pathophysiology. Some pathophysiological condition may lead to the development of a heart failure. These include pressure overload of the heart, example hypertension or aortic stenosis, volume overload, example is valvular regurgitation. Then loss of viable myocardium, that is example is chronic ischemic heart disease or myocardial infarction, and decrease in myocardial contractility, example cardiomyopathy. In sometimes patient heart failure result when the cardiac output is greater than the normal output. This is called as high output heart failure, and this occurs when metabolic demands of tissue are greatly increased as a hyperthyroidism or in the case of pregnancy. These are the causes of cardiac failure. That is first hypertension valve disease, which is increased after the load, leading to myocardial hypertrophy. It is cardiac dilation, again peripheral contraction. Cardiac ischemia, impaired myocardial contractility, again leads to cardiac failure. Here, increased preload, increased ventricular end diastolic pressure, leading to cardiac failure. After cardiac failure, it is due to reduce of cardiac output, reduce the renal blood flow, and sodium water retention is there. That's why there is increase in renin angiotensin and increase in the thirst. This is how the cardiac failure occurs. Sign and symptoms. Increase in extracellular and plasma volume lead to the congestion of pulmonary. Then pulmonary congestion causes breathlessness. Patient may be abruptly awake at night with the feeling of suffocation, fatigue, weakness, nocturia, impairment of memory, confusion, insomnia and anxiety. Then hyponatremia, increase in both serum creatinine and blood urine nitrogen. Urine is usually concentrated with high urine specific gravity and proteinuria. Anorexia, nausea and the feeling of abdominal fullness also occurs. Next disease is arrhythmia. Arrhythmias are irregularities in the heartbeat. It results from the disturbance in conduction of rate of impulses. Arrhythmia may occur in absence of any heart disease or in certain heart disease due to presence of large quantity of drug. Arrhythmia may develop due to electrolyte imbalance, acidosis and certain drugs. Pathophysiology includes, it occurs due to the increase or decrease in automaticity of heart. Now, increase in automaticity of heart may be due to first, high rate of depolarization, more negative threshold potential, less negative resting potential, or a combination of above alteration. This situation may be opposite to this will lead to decrease in the automaticity. Re-entry of arrhythmia depends on the different velocity along with adjacent fiber and unidirectional block in the electrical conduction. Changes in heart rate which occurs in arrhythmia disturbs the cardiac output. In bradycardia, heart rate is less than 60 beats per minute, and in tachycardia, heart rate is above 100 beats per minute. But ventricular filling is decreased and in turn cardiac output is also decreased. Tachycardia results in increase in cardiac oxygen demand but decrease in oxygen supply. Sign and symptoms. Different types of arrhythmias are explained below. First is heart rate is less than 60 beats per minute, commonly seen in patients with hypothyroidism and SA node dysfunction. SA node activity completely stops in sinus arrest. Sinus tachycardia is condition when heart rate is between 100 to 140 beats per minute. Such cases occur due to anxiety, fever, anemia, blood loss, pregnancy, thyrotoxicosis and hypoxemia. Atrial fibrillation is an arrhythmia in which atria do not contract. Thus, cardiac output is decreased and signs of congestive heart failure are common. Then comes atrial flutter. It is a regular rhythm with the atrial rate at around 300 beats per minute and it is seen in the patient with ischemic heart disease, mitral stenosis. Then myocardial infarction. Myocardial infarction is a common manifestation of ischemic heart disease. Pathophysiology of myocardial infarction. Infarcted myocardium is a dead muscle which results from an occluded coronary artery. It shows again three zones: a zone of infraction, a zone of injury, zone of ischemia. The infarct may be the interior portion of myocardium or the complete thickness of myocardium. Then atherosclerosis of coronary arteries is a common cause of myocardial infarction. This narrowing of coronary lumen reduces blood supply below a certain critical level of the blood flow. Myocardial cells develop ischemic injury. Myocardial infarction, that is reversible damage, result from the prolonged ischemic injury to the region of a cardiac muscles. Myocardial infarction occurs in any location in the left or right ventricle, depending on which the coronary artery is occluded. Then, sign and symptoms. Discomfort, which is described as oppressive burning, squeezing, choking, expanding, tightness or indigestion like discomfort is substernal and may radiate to neck, throat, shoulders and arm. Discomfort lasts for 30 minutes to many hours and is very severe. Other symptoms include weakness, fatigue, nausea, vomiting and diaphoresis. Sometimes there is lightheadedness. WBC count increases to 15,000 per mm3. ECG will show T wave inversion. ST segment get depressed. ST segment will get depressed. If infraction is through complete thickness of myocardium, then there is appearance of Q wave. Hypertension. Next, this is hypertension. It is the abnormal elevation of atrial blood pressure. Hypertension may refer to increase in pressure in any blood vessel such as pulmonary hypertension or a portal hypertension. Patient is said to be hypertension when diastolic pressure is greater than 90 mmHg. Hypertension due to some unknown cause is called primary or essential hypertension, whereas hypertension due to identifiable cause is called secondary hypertension. 5 to 20% patient of hypertension shows secondary hypertension and 80 to 95% patient will show primary hypertension. The pathophysiology of hypertension. Renal, there is a retention of salt and water which includes plasma and ECF volume which increases, leads to increase in cardiac output. There is autoregulation, atrial vasoconstriction where increased peripheral resistance, increase in blood pressure due to baroflex, and increase the risk of vascular and renal complication. Next part is due to the renin-angiotensin system that leads to increase in salt water retention, further increases plasma volume, and the path is continue due to which blood pressure is also increasing. Or directly renin-angiotensin system will release the vasoconstriction hormone which is responsible for the vasoconstriction and increase in the blood pressure. Due to increase in plasma and ECF volume, there is increase in sodium in atrial wall which is leading to the atriolar reactivity. Or by the control of sympathetic nervous system activity, sympathetic nervous system activity will also lead to the vasoconstriction which will increase the risk of vascular and renal complication due to increase in the blood pressure. Pathophysiology which we have discussed, it is hypertension may cause damage to various organs like kidney, eye, heart and brain. Hypertension leads to disposition of fibrin in glomeruli. It may cause muscular hypertrophy of afferent atrials. This may lead to renal failure. Hypertension damages to eyes include atrioventricular narrowing, hemorrhage, exudate, papilledema, etc. This hypertensive retinopathy leads to visual disturbance. In hypertension, the stress on the heart increases many times. Due to this increased load, function of left ventricle deteriorates, leading to left ventricle failure. It also promotes atherosclerotic heart disease, cerebral edema, thrombosis and hemorrhage, which are common damages occurring to the brain. Sign and symptoms, that is manifestation. Hypertension is usually asymptomatic disease, although headache, tinnitus, epistaxis is common. Dizziness occurs when diastolic blood pressure exceeds 110 mm. Occipital headache in the morning associated with severe hypertension. Retinopathy causes blurred vision followed by blindness. Brain damage causes lightheadedness, dizziness, vertigo. Then there is a renal failure which also occurs in heart problems, becomes severe. There is a rise in blood pressure that can be detected by during routine examination. Thank you friends. Thank you so much for your patient listening. Thank you.